Diversity in Healthcare panel. Our event is being live streamed on HOSA's YouTube channel tonight, so a big thank you for everyone watching at home. If you have any questions that you would like to ask our panelists during the call, please take full advantage of the live chat. Thank you again to everyone for being here tonight.
Thank you.
Thank, thank you, Shreya. First, we would like to acknowledge that our schools statewide are on the homelands of Native peoples who have lived in this region for millennia. Currently, there are 42 tribes, 35 of which are federally recognized that share traditional homelands and waterways in what is now Washington State. Some of these are nations and confederacies that represent multiple tribes and bands. We express our deepest respect for and gratitude towards these original and current caretakers of this region. As an academic community, we acknowledge our responsibility to establish and maintain relationships with these tribes and Native peoples. In support of tribal sovereignty and the inclusion of their voices in teaching, research, and programming, we also pledge that these relationships will consist of mutual trust, respect, and reciprocity.
So today, we will have the opportunity to learn about what exactly it means to be a healthcare provider and how challenges and successes are woven throughout our journeys. We'll be asking questions to our panel members, and feel free to send any questions you may have in the YouTube live chat. So let's meet our panel.
First, we have Dr. Karima Lalani. Please feel free to introduce yourself to the audience at home.
Thank you so much to Washington State HOSA, as well as WCTSMA, and Elizabeth Hudson for inviting me to this panel discussion. I am currently the program director and a faculty member at the University of Washington School of Public Health for the Health Informatics and Health Information Management program. So we have both a bachelor's degree program as well as a master's degree program. And I am so glad that I'm here with all of you. I come from a non-traditional background, and I come from industry as well. And it's nice to meet all of you. Thank you.
Thank you so much. And next we have Mr. Kent Kazar, so please feel free to introduce yourself to the audience at home.
Hello. Thank you for the opportunity to speak here, to being one of the um speakers. My name is Harold Kent Kazar. I'm from the Philippines, born and raised in the Philippines. I'm a physical therapist in the Philippines, and I'm also a registered nurse in the Philippines as well as here in the States. I work with Child Study and Treatment Center. It's a mental health hospital for children. Yep, I'm so glad to be here.
Thank you guys for being here on our panel. Let's go ahead and jump into the first questions.
Why is it so important that people of diverse backgrounds are involved in medicine?
Kent, why don't you go ahead, please?
For me, it's for the people, especially if you have the same cultural background, religious belief, it seems like they can, they have patients have like the self of belongingness. You can, especially like me being here, my my challenge is like the language barrier. So they can be, they can ask questions. They're not hesitant to ask questions instead of like trying to like uh, reformulate like how to say or how to ask questions like in English or something like that. They can like talk to me in our like vernacular. So it's like it's establishing rapport easily compared to like having and then it becomes like more personalized care at the end of the day.
Like to just add to what Ken said is that coming from the health informatics, health information management background, so we are not patient facing as Kent is. However, we as HIM professionals, we ensure the quality, the availability and the access to of the health information. So it's available to the patient, their caregivers, as well as to the providers for clinical decision making. So that way we can improve population health outcomes. So it is important to have that diversity within that workforce. So that way, when patients see that, okay, how can you help me understand what are some of my discharge steps, or can you help me understand how do I access my information, how do I access the patient portal, what is the information that I need. So a lot of these things, the HIHIM professionals become I would say we are like the linchpin. We're like the glue that, holds the patient, their families, the caregivers, as well as the providers together with the health information and with the health data. And then Kent brings up a really good point because he comes from the provider standpoint. Thank you.
Yeah, thank you for those responses, both of you. So let's pivot to the next question. So what benefits have you both noticed within your field as a result of a more diverse staff?
So the as what I've said, some of the patients, especially like having a hard time like speaking the language of English, can like yes, they have a less feeling of like discrimination because sometimes people tend to ignore them because of like they're having a hard time like understanding their the language. So if you have it becomes like as what I've said, like the you can really understand what they've been through, and they can like express their like what they're feeling, their like their symptoms, and you can explain it to them like thoroughly, so they can better understand what's going on with them, their like diagnosis, their treatments and everything. Uh, what else? So yes, it's become they're having like they can express more, and by expressing more they can like establish trust and the rapport, and it can like for the treatment it can be very beneficial for them, especially if you have to explain to them like how to take this meds and in your like language, compared to like they're just reading. Sometimes like people, I'm not saying that, but people have hard time like understanding, if especially like English speakers like tend to speak so fast, and they're having a hard time like catching up. Sometimes I'm there to like interpret whatever the doctors are been saying or something like that. So yes.
Yeah, I would say from the HRHIM perspective, because we are not patient facing directly. However, it helps to have the cultural sensitivity, so that way, what does it mean, to share data, who can the data be shared with, how do you ensure that data is available and secure and available to only those who are authorized to have it? So it helps us from the back end to have a lot of that grounding and cultural sensitivity, because our providers and our healthcare facilities see patients from a variety of backgrounds.
Definitely. Yeah. Thank you both for sharing those insights. And so, kind of following up on that, how do you both think your identity has impacted how you interact with your peers and patients in the case of Kent?
So especially if they knew that I came from a different background, and when they know I'm Asian and Filipino, so sometimes we have like something in common. They can like easily reconnect with us. I mean, like connect with us, and like what are your favorite foods? What are just like some topics that we have like in common to like establish, like self of belongingness, or like the establish rapport to the patients. Um, So it's been like, it's been awesome to have to like take care of the patients who have, like we can say like minority most of the time. Uh, yeah.
Yeah. Thank you, Ken. I would say from my perspective, because our HIHM work is not patient facing. However, as an educator, as I mentioned in my introduction, that I don't come from a traditional healthcare or an academic background. I come from industry, and prior to joining the field of health information management and health informatics, I used to work in the energy sector. So when I talk to students, alumni, community partners, I share this story that it's okay that it's okay to come from a non-traditional background like myself. And because we can bring in a lot of skills transfer, especially from an HIHIM perspective. We can bring a lot of skills transfer to the table. We can have a lot of value added proposition, because we wear multiple hats, right? As an HIHIM professional, we are your project managers. We are your cybersecurity specialists. We are your data analysts. We are your health quality specialists. And in terms of whenever my peers, whenever they move forward, they also get into the C-suite and healthcare leadership roles as well. So it helps to provide that yes, it is okay to come from a diversity of perspective. It is okay to come from a diverse background, like myself. So I always share that story with our alumni, our students, as well as our community partners.
Thank you both so much. This question is a little bit more personal, but how do you stay motivated when faced with adversity?
So just remember your purpose. Just remember that it's it's always been the passion to help others. Once you have that like passion, everything will be okay. Because just remember, it's not all about like how much you earn. It's not all about, but it's like the the reason for you being there. Sometimes patients don't understand that, but eventually, like after the discharge, they will eventually like like thankful what's going on, especially coming from a mental health facility. It's hard because like they don't want to be there, and then it seems like as a healthcare provider, we are the we are the antagonist. But eventually, over time, they came to realize that we are there for a reason. We're there to help them, and then yeah, it's like the feeling of it's overwhelming feeling of seeing the patient day one. That's totally a different patient when they discharge. So the feeling of like being able to help in that process is you um I can be like speechless of like being there for them. That's all.
Yeah. I would like to add on and echo, what Ken said, that it's about your purpose, right? If what your purpose is. So for me, I get excited, every morning when I start my work, that, I am going to be making a difference in somebody's life. I'm helping to build the future health informatics, health information management workforce, not just in the US, but also around the world. So I really, that is what, that's my purpose. That is what gets me excited, every day. And, whenever there are, forks on the road or, adverse moments, I just sort of come back, kind of like, what Ken said, come back to your purpose, come back to what drives you, what motivates you, and that's how you would move forward.
Yeah, definitely. Thank you so much for that advice. So shifting to the next question, in both of your respective fields, how do you guys work to ensure fair treatment for all patients?
So for me, when during my emergency department days, we tend to have like these different patients, and even though we have like, for example, I have a Filipino patient, I make sure that I will be, like be fair to each and every one of my patients. If I have devoted like time for this patient, I also have to devote like the same, so that they won't feel like being neglected. And sometimes they will see like it's unfair because I have uh like an Asian, I catering to like Asian most of the time. It's not being like that. Just be fair, like how much time like you spend with this patient is also like the way, make sure that you have like, you have the care, and the time you spent will be the same with each and every one of them. Though sometimes patient can vary. Patient can have like this severely ill, may take more of your time, but just to make sure that they would be fair. That's all.
I guess from my perspective, because we are not patient facing, we are in the background. We do, whatever work we are doing in whichever organizational capacity we work in, whether it's, data analytics, cybersecurity, project management, healthcare quality, any of the information governance, any of these buckets that my profession is in, we just make sure that we are doing everything to our utmost abilities and are providing excellent work and excellent service as required by our respective organizations.
Definitely. It's great to hear both your insights. And then how does considering intersectionality, so the sort of interconnected nature of social categorizations, influence your approaches to patient care or data management?
Can you repeat that question for me?
Definitely. So how does your intersectionality or patient's intersectionality influence your approach to either patient care or data management?
Can you? I'm sorry. Can you answer that first,
Oh,
Doctor?
yeah, sure, of course, yeah, yeah. So data, health data, there's always story behind the health data, right? So whenever we are doing, data analytic work or, healthcare quality, patient safety, information governance, we make sure that, we are looking at everything from a holistic standpoint, right? And then that way, when the data is there to tell a story, so, we are able to take that data, visualize it, and present it in a way that, the decision makers can use it. So that way, we have better health outcomes. So I would say it is important from my professional perspective to have a lot of that cultural sensitivity, to be aware of, what kind of patient population is my healthcare organization seeing? What kind of geographic area are we serving? Are there specific Are there specific, healthcare? Are there specific chronic diseases in that specific area that we are managing? Are there specific service lines that we are helping out with? So once that entire perspective is there, then of course, any kind of, data analytics, healthcare quality work that we do, we make sure that, we have that broader holistic perspective in presenting our information forward.
So also for patient with we need to make sure that we have to read their backgrounds, what are their religious beliefs, their cultural beliefs, and from then on we can make our treatment plans and everything. Like for example, if they're like Muslim, so we tend to refer them to our dietitian, or things like that, and if they need to have certain hours of their like religious belief to like pray and things like that, we have to like cater time for that. No, because like not every patients are the same. They have different um needs, different ways of how to live their daily lives. So it's like individualized care for me. Yeah.
Thank you, guys. Shifting to our next question, how can healthcare professionals actively engage but also serve diverse communities to improve overall health, but
You were you were like cutting out. Can you repeat the question?
yeah, I'm so sorry. How can healthcare professionals contribute to, oh, I mean, how can healthcare professionals actively engage with and serve diverse communities to improve health, but also build trust?
So as what I've said, you need to like connect to someone, especially you know um you need to have like interaction. One way is communication, which I'm having a hard time here at first. So just like work in it, work how to uh, establishing rapport to the patient, which is like very important if you're like uh, frontline healthcare staff. Um, and just create a positive environment. The hospital is not like an environment for for like a positive energy, but sometimes you need to like create by just being there at your presence, or like being like jolly all the time. Because like if they're sad and then like you tend to be like also like down and depressed, they can sense that. So you need to be like you know um to create like a positive energy when you're around them. Uh, so probably it really takes like experience and skills to have that. Sometimes you're not there 100% every day. But just keep in mind that to like create a positive environment.
Yeah, to add on to what Ken said, I would say that, volunteering is important. So, for example, the healthcare teams, whether you are frontline or whether you are, you work in the background with, the IT and the operations, like how HIHIM does, I'm a big proponent of volunteering. So, it would be great to, connect with the community, the area that your facility serves. If there's opportunity to volunteer during, there's food drives, if there's Christmas events, other holiday events, for example, if there's a toy drive, there's whatever whatever opportunity that may be, given where your organization, healthcare organization is located. I think it is great. It would be fantastic for the healthcare teams, both frontline as well as the back end teams, to connect with the larger community that they're serving. And so I would say volunteering would be a big one, from my perspective.
Yeah, thank you for sharing your insights. So we're going to jump to one of the YouTube questions that was asked from the live chat. So,
Mhm.
as a healthcare professional, what would you say are the biggest strengths or weaknesses?
Kent, I think you're muted.
Sorry about that. So, coming from a different background, maybe uh, my weakness is like the communication part. When I first started here, it's hard for me to like uh express and like how I feel in my own like dialect, my own language. So just like get to know, practice more. That's how I overcame everything, the language thing. And also probably for me, my biggest asset would be like, uh being from that, like that diverse part. Because like I can I can, like individualize my care, especially if coming from the same background, the same religious belief, the same culture. I know what they want. I know their needs. I know uh, the food that they like. Uh, what else? So things like that. So it's being like part from a like this background can also like create more like sense of like belongingness into like this like section of people, uh and it's it's very like unique that we're we're there, and then like we dwell more like in like generally, um probably yes, I can better understand like people from like my background.
Yeah, so the question was, what are the biggest strengths and weaknesses, correct?
Yes.
So,
Yeah.
yeah, so thank you, Manas. So I would say, uh, and from my perspective, the health informatics perspective, I would say the biggest strength would be the adaptability. Because, as I mentioned earlier, that my profession is a we are like the linchpin that holds we are the glue that holds the front end, the providers, and the back end together, along with patients as well. So being adaptable is, I would say, it is a great strength. And then I would say the weakness would be, to make sure that, you don't burn out easily, right? Because the healthcare field, and with all the changes, that occur, it is very dynamic. So, yes, adaptability also helps you quite a bit. But also, sometimes, you have to make sure that you don't burn out. So, you have to make sure that, there's a lot of self-care that is also involved, in with as a healthcare professional.
Thank you so much for sharing. And so our next question is, do you believe coming from a diverse background impacts the trust and comfort level you have with patients or whoever's data you're dealing with, especially from underrepresented groups?
Uh, for me, it's yes. as what I've said, you can easily like connect to people with the same background. You can build, like relationship, and that, that, eventually trust, like patient and healthcare provider rapport. Sometimes they don't wanna, like, they will ask for you, like if you're the nurse on the next day. I mean, you're not. If you're the nurse and then tomorrow they will be given a different nurse, they would ask for you because like they want to, like, so sometimes it's hard because like you need to be like, to cater other patients. But since they want you to be their like primary care provider, they would like request for you. And I just want to be fair to all of them, that I have to be like, sometimes I can be the nurse for today, but probably not tomorrow. And it's also hard to like say no. I'm sorry, I'm not your nurse for like today. I was like assigned to a different patient. But yes, like they sometimes like needed someone who they can talk to, they can relate to. So yeah, I can say that, being from this background can like help me like communicate more with patients with the same background.
Yeah, I would say from my perspective, being from a diverse background as well as being from a diverse professional background who pivoted into HIHIM, I think that I'm able to connect, I hope, with future HIHM professionals, who might be of the opinion that, okay, maybe I don't want to do direct patient care, kind of like me. That's how I was. Maybe I am good with, data analytics. I want to go more into cybersecurity. I want to go more into, healthcare law or information governance because of AI and healthcare. So, I think that my diverse background and my diverse journey coming into this field, it can help others, who might be on the fence, thinking, is it possible? Can I transfer my skills? Can I adapt? Can I learn something new? So I hope that, my story and my journey can help people, who might be thinking along those lines.
Yeah, totally. Thank you both so much. In your experience, how can the healthcare system better address disparities in patient care among diverse communities?
So for me, like hiring more diverse staff by coming to like a different background would be like beneficial uh to the like organization. And yeah, because like especially here in Washington State, we are so diverse. We are like people of different colors are in here, so might as well like hire more people from different backgrounds.
Yeah, I would say from my perspective, it helps to bring in people from different backgrounds, not just different cultural backgrounds, but also different professional backgrounds as well. Because, the cost of healthcare is rising. There's always, there are different technologies which are coming out. So how do we improve healthcare access? How do we improve outcomes of our populations at large? So yes, it helps to have not just, culturally diverse healthcare workforce, but also, a workforce which is, versed in, different professions as well, and can pivot from another profession into the healthcare profession as well. So I would say it is definitely a win-win situation everywhere.
Yeah, thank you for those responses. So both of you kind of touched on this, but if you would like to elaborate on it more, so how can we as future healthcare providers ensure that we are creating diverse and equitable healthcare experiences?
Um, for me, like volunteering, different, different workplace, different institution. By that, you will be creating more experience, and by having that experience, you can like share it to to your patients, to your um. So once you have those like various skills, various experience, it'll be easier for you to to do the things that you need to do with the patients. Just continue learning and learn new things, learn new skills, trainings, um, if possible.
Yeah, I would say to add on to what Ken said is, of course, volunteer. And then of course, if you have an opportunity to shadow, shadow healthcare, shadow the entire healthcare continuum if you have to, going all the way, not just from a patient-facing side, but also going all the way to the back. So look at how the decision-making continuum occurs. What kind of data and information is captured? How is it looked at? How is that data, looked at and provided from a clinical decision making perspective? This way you will see that how what is it, what kind of impact you can have, what kind of an impact you can have, not just from a front end but also from the back end, and what is it that you can do. So for example, if you come across a patient who says, you see a trend, in the data that, okay, a patient is continuously misses their appointment, and if they do come to the appointment, they are in a hurry to leave because they are saying, "Oh, I don't have a ride." So that you ought to stop and look at that data trend, saying, what is it? What is prompting that patient to reschedule all the time? Is there an issue in terms of their what we call in the public health space social determinants of health, or non-medical drivers of health? Is it do they is there an issue with are they transportation insecure? Is there food insecurity? Is there something that's going on? So I would say volunteer and shadow and look at the entire continuum of care. So that way, when you are out in the healthcare workforce, no matter which facet of healthcare you decide to go into, you would have a better understanding of how the information flows and what kind of data and the story that the data tells, how can it impact your patients as well as the communities that you serve.
Yeah, thank you so much for that advice. I'm sure our audience will definitely appreciate that. And so going back to one of our earlier discussions about language, I'd like to ask, how do you ensure language access for patients who speak languages other than English? And how does this contribute to more of an inclusive healthcare environment?
So we have like a translation, like language translation machine that we use every time we have like a people from a different background. But sometimes it's hard because they're not like a healthcare provider on the other end. So it's we can use the language translator machine. However, the other, on the other side, the people who speaks their language is not a healthcare professional. But once we have that, we tend to have like we tend to ask who are the nurses or like healthcare professional who can speak their language better, who can explain to them better, like in person, um, about their treatments, about their like care. Sometimes we have to like pull out people from emergency department to come to the unit to speak to the patient that speaks with their language and explain to them the care that they will be getting. So yeah, it's nice to have like people who speaks different language in your like hospital or in your facility that you can just like ask, hey, can you like please explain it to like this patient about like how this medication should be like taken, or um yes, we have that, like we have that, like assets. We call them like assets sometimes because like, you know, uh, it's it's not about the language translator thing, because like they're having a hard time like explaining the medication and what is it for, and uh yeah, it's good to have like someone who can speak with the language of the patients.
Yeah, from my perspective, my profession, we use whatever, language translation services that the facility that we work in, what they use. So that we don't come too much into contact with that because our work is not so much patient facing, but at the back end.
Thank you so much. That was really interesting to learn about. Another kind of personal question, but do you have any advice on how to better advocate for yourself?
Uh, for me, probably the hardest part uh that uh I am very afraid to fail. But my advice is don't be afraid to fail. Like, go out, make a mistake, and then learn from it. Everyone makes a mistake. Like, I have so many medication errors, incident reports, and things like that, that it's a learning process, learning curve. Go there, like, do things that you want to do, and like, don't be afraid to like, uh, try another thing. If you fail, you fail. Try again. Just go out. There's so many, like, for a healthcare professional, you have so many options. Just don't don't settle for, just go where you can be happy with your job. Because like, as a healthcare, especially in the nurses part, it's hard. Like, most of the time, it's a very, it's a dip. I used to have like anxiety every time going to work, when I use, especially during COVID. I have to like park 30 minutes before my time, and like just, like, process my anxiety, and then like go to the unit, take care of like COVID patients, and yep, just, like, do what needs to be done, and you know make you sometimes, if it's you can like, everybody makes a mistake, and then just learn from it.
Yeah, I would say, what's the best way to advocate for yourself? Be be a be a team player, lean into to projects where you think that you can bring value to the outcome of that project, and don't be afraid to take on something that you think that, oh my goodness, is this going to work out, not going to work out. So I would say be open-minded, be flexible, be a team player, because healthcare is a team sport. And lean into projects, so that way you are always you're always you're a lifelong learner. So just develop that curiosity, that lifelong learning and curiosity.
Yeah, definitely. Thank you both for sharing your thoughts on this. So kind of just focusing on the solution aspect of our discussion, how do both of you personalize, would you say to personalize healthcare plans to better accommodate the unique cultural and social needs of each patient?
Can you repeat the question?
Yeah, for sure. So how do you personalize healthcare plans to better accommodate the unique cultural and social needs of each patient?
So, as what I've said earlier, you need to like read the history, know their backgrounds, know what they are there for. So by that you can like formulate your treatment plans by knowing ahead of time the reason for them being admitted to a facility. Um, just do your research and everything, and then like um, refer them to necessary healthcare professionals for their like needs, especially like as a team, like like for a healthcare team, you have like various like team for like their diets. They have their like physicians, their psychiatrists, their physical therapists, and their nurses. So like refer them to like necessary like referral for their treatments for them to have like individualized care.
Yeah, I would say from my perspective would be get to know the community where your organization is serving. So that way, if there's any, special things that you need to be on the lookout for, that just so you can increase your cultural awareness. I would say that would become very important, especially for those of us, who are on the back end, and rather than being as a patient-facing provider.
Definitely. Thank you for those insights. And then the next question we have is sort of to hear your sort of opinions on this. Sort of as the healthcare field is getting more competitive, but do you guys think that admitting med students solely on grades is hurting diversity in the medical profession?
Can you answer that first?
Yeah. Um, so admitting med students solely on grades, is that hurting diversity of the medical profession? That is it's a very interesting question, and I'm not sure if there's a really good answer for that, or that, if I'm the right person to even answer that question. Um, I'm pretty sure that medical schools, the admissions committee, I'm pretty sure they look at, I'm pretty sure they interview the applicants, as well as you look at their grades, test scores, or if they're asking for letters of recommendation. So I can't speak on behalf of a medical school, but I would say it would really depend on that specific institution, and what kind of class that they are trying to put together. Yeah.
And I'm sure they have their own reasons, for their like qualifications. That I really not sure of what is it, but yeah, they have their reasons, and sometimes it's not all about grades. It's all about like giving some like healthcare students like a chance to explore. It's not about the grades. It's like about the skills, the development, your like personality, your passion. But once you have that, you know, it's it's like it's not all about the academic part, but you know, that's all I can say.
Yeah, thank you so much. It was really good to hear your guys' opinions. And then this will be our last question of the night. But was there a part of getting your degree, such as a challenging course in college or facing cultural diversity, that you struggled with the most?
So yes, for me, I first took up Bachelor of Science in Physical Therapy. I'm a physical therapist in the Philippines, but not here in the States. So I ended up like taking a nursing degree. Passed both of my exams here in the States and also in the Philippines. So yeah, it's like you need to have both for me. You need to have both. Like you need to have your degree as well as understanding the skills, understanding like the experience, the continue learning. It's not about just the degree. Even if you have the degree, but you don't have, like the world, the healthcare, like is so vast and so like uh very dynamic. So you need to like continue learning. It's not about like, and then even if you learn, you need to like experience. You need to like shadow. You need to volunteer, uh, take some trainings, learn new things, and for the part, learn new technologies.
Yeah, thank you, Kent. That was a great question. So I would say because I used to work in the energy industry, so when I made my career pivot to health information management, I had never taken anatomy and physiology before. So for me, that was a big challenging course, a series of courses to take to become familiar with anatomy and physiology, pharmacology, medical terminology. So once to me that those were like huge challenges, and I think once I got through those specific courses, I was sort of, better able to sort of, things started to fall in place in terms of, health information technology, how the information is used, information governance, quality, then things started falling in place. But the challenging part was the anatomy and physiology and all the science courses which I had not taken before. And I would say, as since this is the last question, that because the healthcare field is so dynamic, it's constantly changing, and of course, having augmented intelligence, artificial intelligence, however AI is called, um, it's also making headway into what kind of impact will it have in terms of the delivery of healthcare, the information sharing in healthcare. So this is if somebody asked me, I would say this is a very exciting time because adaptability is the key. Always have that curiosity for lifelong learning, and keep up with all these changes that continue, that are continuing to happen, and that will continue to happen.
Thank you so much for sharing these. Thank you to Dr. Lalani and thank you to Mr. Kazar for your insightful anecdotes. And a special thank you to our panelists for speaking with us today. We learned so much from you guys. And thank you to all of our attendees for joining and providing these thought-provoking questions that guided this panel today. If you all have any other questions for our panelists, please feel free to reach out to your state officers who can connect you. This meeting is adjourned. Have a great night, and we hope to see you all soon.
Thank you all so much. It was nice to be here. Thank you for the
Thank you,
invitation.
guys.
Thank you.
Bye.
Bye.